In our first Cancer Update installment, Carolina's healthcare system, Levine Cancer Institute President Dr. Derek Ragavan reflected on the great strides cancer research has made over the past 20 to 30 years. In our second and final chapter, he explores the cost of cancer care and access to treatment.
We're spending a lot of time looking at the costs of treatments and asking the question, if treatment number one is very expensive and has a good result, and treatment number two is cheap and has a good result, then let's use treatment number two. If you can manage treatment at an outpatient level rather than admitting the patient to the hospital, it's much cheaper. We have a number of financial counselors who are employed explicitly to help patients address some of these issues.
Access to cancer care has always been a major issue, especially when it comes to reaching out to underserved communities.
With all the improvements in outcome, there are big segments of the population that don't enjoy the same success. Recently, there have been a number of reports that have shown that African Americans in the lower socioeconomic group and Hispanics who either don't speak English or are in the lower socioeconomic group, they tend to have lower cure rates for many of our curable tumors. So, our approach at the Levine Cancer Institute is we have one class of patients. Whether they're wealthy or poor, we try to treat everybody in the same way on standard, evidence-based approaches.
And coming soon, Levine Cancer Institute will have a mobile CT unit. Its purpose? To travel around to underserved communities in the area to look at high-risk individuals who may have early-stage lung cancer. It will be able to diagnose them and get them into early treatment before the cancer spreads. And the takeaway in all this?
Cancer is not a death sentence. And many cancers that were incurable 20 years ago are potentially curable today or can be turned into a chronic illness that is kept under control and will leave a patient well. There's been major progress in science, there's been major progress in technology, major progress in medicine, and at the Levine Cancer Institute we leverage all our information to provide that type of university-class comprehensive cancer care at 25 sites scattered throughout the Carolinas, both in big urban centers and in little townships.